Today, I would like to talk to you about strategies to pass NCLEX RN exam. I know NCLEX RN exam has been a major problem to many people, many nurses who want to pass exam and move forward with their career in United States and in Canada. And so today, I want to talk to you about how to select the right answers when you have NCLEX related question. It is very, very important to understand how to select the right answers, because these strategies can help you to eliminate the most unlikely answers and still have 50% chances of getting the right answers. And so, before I start teaching the strategies, I first want to say that there are principles that can help you to select the right answers when you are confronted with NCLEX question. Number one, a registered nurse can never delegate nursing education, that is teaching. A registered nurse can never delegate nursing assessment, and a registered nurse can never delegate nursing judgment. It talks around delegation question. So if you have any question that says, which of these will a registered nurse delegate? It means you cannot pick any assessment question because a registered nurse can never delegate assessment. You cannot pick teaching because a registered nurse cannot delegate teaching. And you cannot pick nursing judgment because a registered nurse cannot delegate nursing judgment. That is principle number one. Principle number two, in nursing, assessment takes priority over intervention. What does this mean? It means that if you have any question that gives you an option of selecting assessment over intervention, you're going to pick assessment. Assessment trump intervention except for the case of emergency. So therefore, when you have any patient, you need to prioritize your assessment over intervention, because assessment trump intervention except for the case of emergency. In the case of emergency, you need to prioritize intervention. But if the case that is given to you is not an emergency case, then your answers are most likely going to be assessment. Let's practice a little bit with these two principles. And I'm going to practice making use of Kahoot, which is a software that we normally use for people who want to, who is interested in practicing with NCLEX related question. I'm going to start in a moment here. When you look at this question, a patient is bleeding. For every question in NCLEX, there are two things. They are going to give you a background information about the patient, then they are going to ask the question. The background information is that the patient was diagnosed with internal bleeding after a motor vehicle accident. What is going to be your primary concern? Well, A says mental alertness, B says pain. I want you to know that in NCLEX exam, all pain are regarded as psychosocial need except for chest pain. If a patient is having chest pain, it becomes a serious concern. But if it is not chest pain, if it is ordinary pain, of course, it's considered as a psychosocial need. That is the way the question most times see these things. So therefore, will pain be the primary concern when a patient is bleeding? No. So you want to eliminate the wrong option first. So therefore, I am going to strike pain out. Then I have mental alertness, perfusion, and urinary output. Let's look at perfusion, the ability of the organs to get oxygen and glucose. And we all know that if the brain doesn't get oxygen and glucose on time, it dies. If most organs don't get perfused, the system goes into a state of shock. So perfusion could be the likely option. Number C. But we'll leave mental alertness, we'll leave perfusion. Let's look at urine output. If somebody is bleeding, urine output, will it be the priority to think about? Definitely no. So therefore, I am eliminating pain and I am eliminating urine output. And I am leaving mental alertness and I am leaving perfusion. And I want you to think for a minute. Between mental alertness and perfusion, which one is most important? If the brain doesn't get blood, for 2 to 6 minutes, infarction begins to set place. So you want the brain to be perfused, you want the heart to be perfused, you want the essential organs in the system to be perfused. So therefore, you are more worried about perfusion because if there is no perfusion, the body goes into a state of shock. So in this case, the answer is perfusion. I want to tell you, the best way to answer NCLEX question is not going right away to pick the right option. The strategies is eliminating the options that are not right so that you can have some little time to focus on the options that are right. That is the strategy that I want to encourage you to approach the question with. Eliminate options that are not right and consider the options that are likely to be right. So in this case, perfusion will be the right option. Let's look at another question here. Which statement by a client alert the nurse of the possibility of right-sided heart failure? Which statement by a client alerts the nurse about the possibility of right-sided heart failure? A. I sleep with 4 pillows at night. B. My shoes fit tightly lately. C. I wake up coughing every night. D. I have trouble catching my breath. When we look at these questions, it's talking about the possibility for signs and symptoms of right-sided heart failure. We all know that with right-sided heart failure, there is massive edema all over the body. There is systemic edema because we understand that with right-sided heart failure, there's a fluid overload. And that fluid overload affects every part of the body. So the patient will develop edema in every part of the body. And so, the first option says, I sleep with 4 pillows at night. When you look at that option, it really didn't give you any further information. Perhaps it tells you that the patient doesn't feel comfortable, but it didn't give you any further information. It doesn't lead you anywhere. It doesn't give you any specific information. But when you look at B, for instance, my shoes fit really tight. It's showing that there is a swelling of the leg of the patient. And so it's indicating a signs and symptoms of edema, which is usually seen in people that have right-sided heart failure. They will have edema. It means the leg of this patient is getting big, such that the shoe can no more size the patient. That's what that tells us. Then C, I wake up coughing every night. It means that the patient has a difficulty every night sleeping. And we know that with a left-sided failure, a patient always have pulmonary edema, so they cough a lot. they don't sleep a lot at night. So we leave that option there. Then D, I have trouble catching my breath. A lot of people that have both left-sided failure, right-sided failure, have trouble catching their breath. So which one of these? The only option that points to generalized edema is B. It's a question that is asking you whether you know the signs and symptoms of right-sided failure, which is always characterized with generalized edema. So this is the right answer because it's showing that the patient's leg is swollen, and you don't expect the leg to be swollen alone, you expect edema in significant part of the body in this case. So therefore, the answer in this scenario is B. The answer option C, waking up with coughing every night, is peculiar to left-sided failure. In left-sided failure, patients always have difficulty with sleeping because of the pulmonary edema. And so let's look at the next question to see what it looks like. Which patient should you identify being at greater risk of left-sided heart failure? Now, these are risk-related questions. In the NCLEX exam, I want to tell you a little bit about how to answer risk-related questions. Which of these patients should be identified as being at greater risk for developing left-sided heart failure? Let's look at that. Now, risk-related question, there's an approach to those kind of questions. Any question that asks you about which of these patients are the greater risk, you want to approach the question by analyzing every option that is given to you and looking at each risk factor in each of the questions. Because if you look at these 4 options, each of these options you will analyze. You will do what is called risk analysis here. Which of these has a greater risk than the other? Option A, a 36 years old woman with aortic valve stenosis. Now, the fact that the lady 36 years old with aortic valve stenosis. Aortic valve stenosis is a risk factor for, number 1 risk factor for left-sided heart failure. Number 1 risk factor. A 42-year-old man with pulmonary hypertension. Pulmonary hypertension, of course, could likely result into this, but it's not the main risk factor for aortic stenosis. A 59-year-old woman who smokes cigarette daily, they are not going to have, a patient who smokes cigarette may have left-sided failure, but she's not going to have left-sided failure the day he starts smoking. It takes a long time because smoking causes vasoconstrictions of the blood vessels, therefore can impact on the heart. So smoking can result into left-sided failure, but it's not going to happen overnight. Then when you look at option D, a 2-month-old infant with pulmonic valve stenosis. When you look at the pulmonic valve stenosis, it's looking at the right side of the heart. Yeah, the right side of the heart, not the left side. But aorta is in the left side of the heart. So aortic valve stenosis, this could happen with the right side of the heart, but aortic, because aorta is in the left part of the heart. Aorta is in the left part of the heart. So a patient with aortic valve stenosis are likely to develop left-sided failure. And this is where your anatomy comes in too. You look at it, aorta is on the left side of the heart. We are talking about left-sided heart failure. So the answer here is A. Aortic valve stenosis is one of the main risk factors for left-sided failure. When you look at B, it's talking pulmonary hypertension happen at the right side of the heart. Cigarette is not going to cause left-sided heart failure immediately. And pulmonary valve stenosis at the right side. Right side of the heart, right side of the heart. The one in red is the only one that has to do with the left side of the heart. So the answer is aortic valve stenosis. Let's quickly look at another question, because I didn't forget about those principles I earlier talked about. And this is the example of a question that will tell you a little bit about the principle I earlier talked about. Which nursing action can RN delegate to experienced, unlicensed, assistive personnel working as a telemetry technician? You are going to find a lot of this kind of question. It is always called delegation question. Now, how do you delegate as an RN? You don't delegate assessment, you don't delegate judgment, you don't delegate nursing teaching, but you can delegate also based on experience of the person you need to delegate to. For instance, if you are a nurse and you are delegating to another nurse, you can delegate to that nurse based on the experience of that nurse. For this kind of question, he said, which nursing action can RN delegate to an experienced unlicensed assistive personnel as telemetry technician? A, decide whether a patient heart rate of 116 require urgent treatment. When you look at that, that cannot be the option, because nurse can never delegate nursing judgment. When you see the word decide, it's a decision, it's a nursing judgment. So you cannot delegate nursing judgment. In other words, anybody that is not a nurse cannot make clinical decision. So therefore, A cannot be the right answer. Let's look at B. Observe heart rhythm for multiple patients who have telemetry monitoring. Well, if it's just to observe, that is a possibility. So we'll leave B. Let's look at C. Monitor a patient level of consciousness during synchronized cardioversion. You cannot delegate monitoring of an unconscious patient, or the monitoring of a patient is seen as an assessment. So you can't delegate monitoring because it's an assessment. So C is out. Let's look at D. Select the best leg for monitoring a patient admitted with acute coronary syndrome. You cannot, because you see the word monitoring, you cannot delegate monitoring here, because it's monitoring an unstable patient. So let's look at B. This person is trained as a telemetry technician, so the person can actually observe, but the person cannot make decision. The person can observe, but the person cannot make informed decision based on their observation. When you look at that, this personnel is a telemetry technician, so you can let them observe, just to observe telemetry monitoring, because they have the experience in that area. But for instance, even if this person is not a telemetry technician, they might not even be able to observe, because observation could also be like a nursing thing. So when you want to delegate based on the experience of the person you are delegating, and don't delegate teaching, don't delegate decision, as we have seen in this case. Let's look at another question here. Patient has mandatory ECG before participating on a college soccer team and is found with bradycardia of 52, BP of 114/54. What is the next thing to do? I want you to know that athletes have low sinus reading. They have low pulse. The pulse rate of any athlete is always very low because of the kind of sport they do. So, the normal pulse rate is between 60 to 100. But that may not be the case for athletes because of the kind of sport they do, their kind of activities, the strain on their heart has an impact on their pulse physiologically. So this is an athlete, and he had an ECG before a sporting event. So A says allow the athlete to participate in the soccer team. B says refer to a cardiologist for further testing. When you look at the blood pressure, it's fairly okay. And if you understand this, that athletes always have bradycardia, sinus bradycardia, there's no need. There's nothing in that question that is suggesting there's a problem. There's nothing in that question that is suggesting there's a problem, rather than he has a bradycardia of 52. So in this case, you cannot really refer to a cardiologist. So refer to cardiologist is out. Let's look at C. Tell the patient to stop playing immediately if they have dyspnea or cough. There is nothing given to us in this case. There is nothing given to us in the question that shows the patient will have shortness of breath. So always look at your question and always look at your answers. Whatsoever is not given to you in your question, you need to be very careful not to include it in your answers. So tell the patient to stop playing immediately if there is any dyspnea. There's nothing that shows the patient have an heart failure or have any asthma, so that is struck out. So B is struck out, C is struck out. Obtain more detailed information about the patient family health history. Well, so it's between, it's not bad to always obtain more information because nothing much is given to us. But when you look at both option A and D, you will note that people who are athletes experience sinus bradycardia. So there's nothing wrong with this person. The BP is within normal range. Nothing much information is given to us. Allow the patient to participate in the soccer team because it is normal for athletes to experience sinus bradycardia. Let's go to the next one, which is number 6. Today I'll be reviewing 9 questions, and if you watch this and you liked it, we can move forward. I can do more questions and all that. The next question: a patient whose heart monitor shows sinus tachycardia rate at 132 is apneic and has no palpable pulses. What is the next action? Patient with pulse rate of 132 is apneic and with no palpable pulses. What will be your next? What will you do next? The first one says perform synchronized subversion, cardioversion. B says start cardiopulmonary resuscitation. C says give atropine by agency dyspnea protocol. D says provide supplemental oxygen via non-rebreather mask. Let's look at A for instance. Perform synchronized cardioversion. A patient heart is still breathing. The heart is still working, though it's working abnormally very fast. So you don't need cardioversion at that point. You only do cardioversion in case of atrial fibrillation or the patient is no more, the heart of the patient has stopped. But the mere fact that the patient has a pulse, you don't have to do cardioversion because the patient has a pulse. Let's look at the second one. Start cardiopulmonary resuscitation. That is possible because the patient is apneic. Apneic means the patient is not breathing. So do you need pulmonary resuscitation? Yes, because the patient is not breathing. C, give atropine per agency. Atropine is not going to do anything here. Because when you look at atropine, I don't want to go into details of atropine right now, but if you look at atropine as a resuscitative medication, it's not going to kick into action. Even if you give it right now, it's not going to kick into action. It's not like epinephrine that kick into action very quickly. And giving oxygen could be the right option for sure, but this patient is not breathing, no palpable pulses. It means something is going wrong. Perhaps the airway of the patient is not even open. So if you give oxygen, the airway of the patient is not open, it's not going to help. But when you do cardiopulmonary resuscitation, you are opening the airway, looking at what the problem is. Because this kind of problem could be as a result of the airway obstruction. So you are opening the airway and you are monitoring the pulse and you are giving breathing to the patient, and that could make apnea to resolve, breathing to come back, and that could make heart to work. This is a kind of a patient that could be as a result of the fact that they don't have enough oxygen, maybe because of the airway obstruction. So you want to start your CPR. CPR in this case of emergency, look at this case as a case of emergency. CPR will be the right thing to do to resuscitate the patient. This is a kind of an emergency where resuscitation really makes sense. A 75-year-old patient will be undergoing a mitral valve replacement for severe mitral stenosis. Which of the disease may be in the patient history? You know, just like I said in every NCLEX question, they will give you the background information and they will ask the question. The first statement is the background information. The second statement is the question. And sometimes the background information may not be connected to the question, so you need to be very careful. Now, a 75-year-old person with mitral valve replacement for severe, is undergoing a mitral valve replacement for severe mitral stenosis. Which of these diseases may be in patient history? A, meningitis, B, rheumatic fever, C, varicella, D, Haemophilus influenza. Now, meningitis doesn't predispose people to heart problems. Meningitis can predispose people to brain problems like encephalitis, inflammation of the brain. But it doesn't predispose people to heart problems. But when you look at rheumatic fever, it's one of the main things that predispose people to heart problems, like endocarditis. Among every other problem, rheumatic fever predisposes people to heart problems. So a lot of people that have had history of rheumatic fever experiences heart problems. Another thing I want to say here, individuals that have visited dentists and have their tooth pulled out, they are also predisposed to some heart problems because of the causative agent for the rheumatic fever. So rheumatic fever is one of the risk factors. If you have had rheumatic fever before, it's one of the risk factors that could, down the line, result to a cardiac problem. Varicella, chickenpox, doesn't result into heart problem. Influenza doesn't result to heart problem. This is a kind of a question where you need the knowledge of the content to be able to answer. But I want you to remember something today. Rheumatic fever can predispose a patient to heart problem. These are the kind of questions that you probably don't use principle to answer, but you use your knowledge of the content to answer. Let's go to the next one here. A nurse evaluates the prescription for a patient with chronic atrial fibrillation. Which med can prevent common complication? A, atropine, B, epinephrine, C, warfarin, D, lidocaine. Lidocaine is used as a local anesthesia for pain, so it can never be lidocaine. We are talking about atrial fibrillation here. The option D is out. It cannot be lidocaine because lidocaine is used for local anesthesia. to kill pain when they want to operate a site, or to make a patient not to feel pain. So atrial fibrillation is a condition of the heart. And most times they use lidocaine tropically, externally to the skin, to the local site. So it can't be lidocaine. It leaves you with 3 questions. I want you to see each question at 25%. Anytime you eliminate incorrect option, the chances of getting correct option is 75%. If you eliminate 2 incorrect, the chances of getting the right answer is 50%. So I am going to be doing series to teach you how to remove 2 that are most unlikely and how to look at 2 that are likely and probably pick the right one. So lidocaine can never be. Epinephrine is a resuscitative medication. If a patient is going through shock, if a patient is going through anaphylaxis, they use epinephrine in emergency. And this patient has chronic atrial fibrillation. And the question is which kind of medication can prevent? Epinephrine cannot be used for prevention. It can be used for resuscitation in most cases. When a patient is in active stage of emergency, like going through anaphylaxis, going through shock, they use epinephrine. So it's a resuscitative medication. It's not used for as prophylaxis. So it cannot be epinephrine. So it leaves us with 2 options: atropine and warfarin. We all know that warfarin is an anticoagulant. And therefore, a patient that has chronic atrial fibrillation, it means that the heart will beat very fast at some point, and the heart will be very slow at some point. So the chances for this patient to have heart failure, or for this patient to have pulmonary embolism, is high. The chances for any patient that has atrial fibrillation to develop blood clots, and such a blood clot can block the heart or can block blood from flowing to the brain, is high. So one of the main things you want to prevent in atrial fibrillation is to prevent clots, because the chances of clot are high. So you want to place the patient on warfarin, which is an anticoagulant, to prevent blood coagulation. So you want a patient with chronic atrial fibrillation has to be on warfarin. If you don't want to give warfarin, another anticoagulant is coumadin. And so warfarin, coumadin are medication that can help in this case, so that this patient will not develop thrombosis or it will not develop emboli. And emboli can kill. Is the third pulmonary emboli is the third leading cause of death in the United States. It kills people less than 20 minutes. Blood clot, the pulmonary artery or the pulmonary vein, the patient can die very quickly. So you don't want any patient with atrial fibrillation to develop a blood clot. So therefore, the answer is C, warfarin. You give warfarin to any patient that has major heart problems because you don't want complication about pulmonary embolism, complication like stroke, because blood clot can also cause stroke, or complication like heart failure. So you want to prevent complication in this case. The last but not the least question is question number 9. And let's look at what question number 9 says. And it talks about teaching, preoperative teaching. Joe's is a 4-year-old child scheduled for a cardiac catheterization. Preoperative teaching should be for a patient that is scheduled for cardiac catheterization. What should be your priority? A, adapted to his level of development so that he can understand. B, detailed in regard to actual procedure so he can know what to expect. D, directed at his parent because he's too young to understand. D, done several days before the procedure so that he will be prepared. Now, this is a kind of a question that how do you do a preoperative teaching for a child? Joe's is a 4-year-old child. How do you do a preoperative teaching for a 4-year-old child? It is important that adapt to his level of development so that he can understand. Is it important to let the child know what is going on? Yes, it is important to let the child know what is going on. And therefore, you cannot teach a child the way you would teach adults. So you have to adapt your teaching to his level of development. B, detail in regard to actual procedure. A 4-year-old cannot understand detail. They don't understand details. You can't give detailed information to a 4-year-old child. They are not probably going to give you attention. So they don't understand. I can't tell a 4-year-old child, you know what? We're going to put a wire in your heart and we are going to do some electromagnetic. It doesn't make sense to a 4-year-old. So therefore, it doesn't understand details. The parent can understand details, but the child doesn't understand details. So detailed information for a 4-year-old is out of line. So we are going to cross that out. Then C, directed at his parent because he's too young. In nursing, we don't say any human being is too young. We don't say anyone is too young. A 4-year-old is not too young to learn certain things. So it's important. That question, what is wrong with that question is, that question is shifting attention away from the child to the parent. And that is what is wrong. You don't direct attention of care away absolutely from your patient to the caregiver. So therefore, a 4-year-old will still understand some things. So therefore, C will not likely be the right answer. Then D says, done several days before the procedure so that he will be prepared. Several days before the procedure, a 4-year-old will likely forget. So the two most non-likely answer is B and D. I am going to now spend my time on adapted to his level of development so that he can understand. C, directed at his parent because he's too young to understand. Those are the two likely ones. And I, as a nurse, will rather focus on adapting my teaching to the child so that he can have an idea. Because a 4-year-old can still think. A 4-year-old can still listen so that I can adapt. He deserves to know what is going on in his body. So the focus should always be on the patient. You will come along questions. So the answer here is A. Now you're going to come along questions where it will give you an option of whether to put the focus on the patient or focus on the machine. Always focus on the patient. If you will come to meet a question where you will look at either to put focus on the patient or on the caregiver, the focus should always be on the patient. Your patient is priority. So down the line, we'll be looking in the future at how to select questions. But remember some of the principles we have discussed today. Never delegate nursing judgment. Never delegate nursing teaching. Never delegate core nursing assessment. Never delegate. When you find yourself in any unit working, you prioritize unstable patient over patients that are stable. Which of these patients should you attend to first? Always look at such question and say, which one of these is most unstable? You prioritize unstable patient over stable patient. In the next couple of weeks, I'll be taking us through this and taking us through how to answer some questions. And all I need you to do is to just watch and ask questions and show interest that you are interested in going along. I thank you for giving the attention at this time. If you have questions specifically, you can drop it for us on the Facebook page and on the YouTube page. I am much more than happy to answer your question. We'll continue with this series of strategies to answer NCLEX questions because I look forward to seeing you succeed as a registered nurse in the United States, just like I did. Thank you very much, and have a wonderful rest of the day. Thank you.